This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
Pain, headaches, and fever? Take one MedLemon hot medication in the morning and one at night to feel sharp again.
This time of year, we get bombarded with products claiming that they can cure colds and flu. So how does one go around in choosing the right product? Well, I'm talking to pharmacist Rakesh Sibarath today, who can shed some light on the matter. Hi Rakesh, how are you?
I'm good, and you, Ilse?
I'm very well, thank you. What are the treatments for the common cold?
Look, first of all, there is no cure for the common cold. Treatment is two-phase. Number one, to help make you feel better, and secondly, we have to manage the symptoms and try and help fight off the virus. The most important thing in treating a common cold is rest. Rest is vital. You may find that you may need up to 12 hours of sleep every night, so just make sure you don't set that alarm. There are various products available to treat or manage the symptoms of the common cold. We can use our painkillers, our antipyretics, which are normally used to bring down fever. There's antihistamines, decongestants, and cough syrups available.
But how do I make sure that I choose the right product?
Pharmacies are quite well stocked with different products. You need to ask yourself certain questions, and especially ask your pharmacist. Like, should I be taking antihistamine or a decongestant? If you have a runny nose or a postnasal drip, itchy eyes, watery eyes, then we can use one of the antihistamines. That will slow down mucus production and help to dry everything up. If you're quite congested in the sinuses and you can't breathe well, then we can use one of the decongestants, either orally or with a nasal preparation. Second question, do I need a cough syrup? Have I got a dry or phlegmy cough? Your pharmacist should definitely be able to suggest the right cough syrup. From your symptoms, whether you've got excess mucus production or whether you've got a dry, hacking cough, there's quite a few questions that he'll ask you and then be able to answer that. And more important, what people often ask about is something for pain and fever. We can often look at paracetamol, ibuprofen, aspirin. These will all work quite well for that.
Well, speaking of which, if you are a bit active during the day, which products would you recommend?
Let's keep it simple, especially when it comes to antihistamines. A lot of over-the-counter antihistamines or cold and flu preparations have drowsy-making antihistamines. So you don't want to affect your day-to-day work, driving around, anything like that. So make sure you ask for a non-drowsy antihistamine. Certain cough syrups can also make you drowsy. If they contain a cough suppressant, something like codeine in them, they're going to make you drowsy. And then on the other hand, if you want to be more alert, your decongestants will definitely keep you awake. So try not to keep using them till too late in the afternoon. Keep it latest to about 2 or 3 o'clock in the afternoon.
And during night times, would the products differ?
For nighttime usage, I will definitely recommend something that can make you a bit drowsy. If you use one of the cough syrups that do have a bit of codeine, that's fine. It will definitely ensure a bit of good night's sleep. Also, for your sinus preparations, your antihistamines, those do make you a bit drowsy. So there's no problem in having a few hours extra sleep.
So when can you combine products?
Look, combining products is especially important if you have a multitude of symptoms. If you're congested, you're coughing, pain and fever, then definitely combine products. Take, for instance, one of the products that do have either paracetamol or aspirin together with a decongestant and an antihistamine, it will work wonders. And if there is a bit of postnasal drip that's causing cough, let's add a cough syrup.
Rakesh, do antibiotics work in the treatment for colds and flu?
Look, when you're feeling lousy, especially with the cold or even worse with the flu, most people turn to the doctor and say, I want an antibiotic. Antibiotics do not cure your colds or your flus. Colds and flus are caused by a virus. Antibiotics treat bacterial infections like pneumonia, bronchitis, or even pink eye. So try not to get an antibiotic. When people use antibiotics for treating a common cold, we build resistance, and eventually the antibiotics are not going to work to treat bacterial infections. And remember, it's only a doctor who can prescribe an antibiotic. So if you think your symptoms are taking longer to cure or getting worse by the day, then speak to your doctor about getting an antibiotic, if you need it.
Thank you, Rakesh, for sharing your insights with us.
It's been a pleasure.
If you have further questions or queries on this topic, make sure you consult your doctor or your pharmacist.
Introducing new 18-pack MedLemon hot medication. Bigger pack, greater value. Feel sharp with MedLemon.